Veneers are a very thin piece of porcelain that gets bonded to the front of your tooth. I like to explain veneers to people by pointing out that ladies like to take the fake fingernails and they glue them onto their fingernail to make it look better. Okay, and so a veneer is indicated in people that are unhappy with the appearance of their teeth, but for all intents and purposes, their teeth are in good health. Veneers can't make anybody's teeth look perfect. Sometimes we would prefer that the smile that you're unhappy with is treated with braces to put teeth where they should be and not to hide the issue with a veneer. Veneers work best in the people that either are very unhappy with the shape or the color of their teeth. To make a veneer, we reduce about 1/2 millimeter of your tooth structure. So it's a very conservative approach to having a nice looking smile. Whereas a crown requires you to remove 1 to 1.5 millimeters all the way around your tooth, a veneer is about 1/2 millimeter right off the front of your tooth. So it's very conservative. And so we can take off just that little bit of your enamel and then get our impression, send it off to the lab, and they make these very, very thin pieces of porcelain that fit and are bonded. Now when I say bonded, they're bonded very strong onto the tooth structure. Because we only take 1/2 millimeter of your tooth structure off, we are still in the enamel of your tooth and we have not gone as deep as getting into the dentin or the underlying structure of your tooth. And enamel is a very easy material for us to bond to. We can achieve a very strong bond from a veneer onto a tooth. I've seen veneers in patients well over 15 years. Veneers are most successful when they are bonded to enamel. So if you have some fillings in your front teeth that are very deep, a veneer is not always the best option. Sometimes a crown in that situation is the best option because a crown can be cemented on, it's not bonded into place. A crown is cemented into place. And so if you have a veneer and there is decay that goes under the veneer and it gets all the way through the enamel into the dentin, that's when we start thinking of other things. As long as we can have that bond all the way around that veneer, we feel confident bonding one into place because we feel like things are going to hold up and it's going to be in your best interest. But if we feel like it's in your best interest to go with something more like a full coverage crown, then we would advise you on that. And, you know, every tooth is different. You might have 3 teeth needing crowns and then, you know, maybe the other 5 on either side of them may still be able to have a veneer. And labs nowadays are getting very good at making those different kinds of restorations match quite nicely. The thing about veneers is often when people are coming and seeking veneers, it's because they want their smile to look nice. And if a smile goes from here to here, you might be looking at anywhere from 8 to 10 veneers to really transform your whole smile. And I'm not saying everybody needs that many veneers for their smile to look nice, but you know, if I'll just say $1,000. If one veneer is $1,000, 8 veneers is $8,000. So you can see it can get very expensive. But the benefits to veneers far outweigh the expense if you can handle the expense, meaning self-confidence. You know, people who have gone through and had that kind of a procedure done because they were very self-conscious about their smile are a whole different person. They have a bright and beautiful smile, and they are very proud of that smile. And so cost can be a deterrent to some people, but it's less expensive than a crown. It's more expensive than a filling. It's somewhere in between, but the benefits are really huge.